I'd like to just welcome everyone to the Resilience and Mental Health Conditions panel. We're going to start with our first scholar. Dr. Yuval Neria is Professor of Medical Psychology at Columbia University, Departments of Psychiatry and Epidemiology, and the Director of PTSD at New York State Psychiatric Institute. So we'd like to welcome him, and I turn it over to him for his first presentation.
Good morning, everybody. Thank you for attending this exciting meeting, and thank you for the police department for organizing that. I would like to focus this morning on the mental health aspects of the COVID-19 epidemic, and perhaps touch upon the way those issues have some implications for police force in New York, but actually everywhere. And so let me start by kind of pointing to the problem, as perhaps everybody is aware to the magnitude and the unique scope of this pandemic. It's not yet over, and it continues to spread around the world, and causing vast numbers of hospitalizations and deaths. We are over 200,000 individuals who lost their lives as being infected by this pandemic, and the numbers keep growing. However, most of the attention so far has been focused on the risk itself, the way to cope with it, issues of therapeutics and vaccine, which are all very, very important. And we are very hopeful that those efforts will be fruitful. However, the mental health crisis is coming and is looming, and I would I have always thought that this will be really the next pandemic that we are going to face, especially among high-risk groups. And my concern is really based on a number of factors that are known to contribute to mental health problems, such as loneliness and shrinking of social support, and families are separated, and elderly are separated from their sons and daughters and grandchildren. People need to self-quarantine, have been self-quarantined. There is a massive anxiety around many areas in this country. And of course, a lack of effective therapeutics, lack of vaccine, unknown future about the development of those, coupled with severe financial difficulties, layoffs, unemployment, and of course the exposure to death. Together, all those factors are especially prominent in bringing a wave of mental health needs that need to be addressed. And there are a number of factors that really already known to contribute to the risk, kind of mediate or moderate this risk, particularly the vast focus and exposure to the media, and a number of studies already from both kind of pandemic studies as well as previous studies from 9/11 have been pointed to a very concerning correlation between time of exposure to social media over our phones or laptop screens and mental health problems. I spoke about the lack of social support, especially on the long term. You know, we human beings are social species. We prefer to be together with family and friends. We need them, they need us. And when we are forced to be without them, we should expect, you know, depression, anxiety, etc. People are telling us about very prevalent sleep disruptions. They are going to sleep late, they don't sleep well, they have a hard time to either wake up in the mornings or sleep normally. Sleep is very responsive to sleep behaviors, and sleep routine is very responsive to stress. And when we don't sleep well, we don't function well. In addition to that, people who tend to be less aware to their physical health, I would just say that physical exercise is always very important. There are numerous studies on relationship between physical exercise and physical health, and then physical exercise and mental health. And when this is disrupted, and normally it is disrupted throughout the pandemic, the results are shown. And on top of all of that, as you all know, especially people who serve this country in police forces, civil unrest is becoming you know, a phenomena that take a lot of focus and deserve a lot of focus. Systemic racism has been a problem in this country for a long time. People are going to the streets, or have been going to the streets, in order to protest and to demonstrate, which is of course one of the main principles of our democracy. But altogether there is a sense of tension and unrest, which is very much related to how we feel and affect our mental health. And on top of all of that, elections is coming in about 5 or 6 weeks, and there are concerns, there are political concerns, and together with unemployment, risk of infection, we are talking about kind of a mental health, pretty kind of explosive time. And the question is whether we are ready, and what readiness really mean. And I would say that like the medical pandemic, the question whether the mental health systems are well set up in order to address kind of large need among the population. I think we know the answers. I don't think we are ready. I don't think the country is ready, especially because most of our infrastructure is really designed upon kind of outdated models of face-to-face, office-based service delivery, and this system is definitely not designed to meet a large, you know, sudden demand. So another couple of points that I would like to make here in this very brief lecture. The question is really who is at risk, or who is at the highest risk, and we have already data coming out from this country, from Europe, from China, and we know already that healthcare workers are at high risk. We understand, I think, intuitively why they are most exposed to the disease. doctor, nurses, EAT workers, etc. First responders and law enforcement personnel are similarly at risk for developing, stress-related mental health problems, and we should be aware to that. In addition to other groups in our society, especially essential workers, and essential workers are mainly made of low-income individuals that need to go out to work. There is a correlation between minority status, low income, and essential workers, which made minorities in this country, especially Blacks and Latinos, more likely to be infected, more likely to die, and also more likely to present with mental health problems. Needless to say that families who lost loved ones, bereaved, and COVID patients are also at high risk for mental health problems. So I would like to kind of illustrate kind of a very general outlook of what the psychological fallout of the COVID-19 pandemic. So we have the pandemic, coming to our country early February and end of January, with massive amount of stress and loss that increased over time as part of the infection rates, mortality, hospitalizations. And but nevertheless, and important for this meeting, is the fact that human beings are very resilient. And we expect really most of us to present a pretty much a kind of a resilient response to the pandemic without serious mental health problems. Everybody may feel anxious at times, perhaps even panicky at times, and may experience sleep problems, may experience even depression at times, especially when anxiety is kind of diminished over time. But yet, we expect the majority of the population to present a pretty resilient response. However, there is always a significant minority that will need help, mental health help. People who will respond with anxiety levels, PTSD, depression, complicated grief, of course, and we need to address their mental health needs, and I would say we need to do it systematically, and because we are not set and not ready to see them in our offices, the question, what should we do? And this is also true for our law enforcement personnel, across the country, especially in places that there is more concentration of the infection, like Texas, like New York, of course, and Texas and California. What should law enforcement leadership should think about? I think the main goal is really to prevent long-term problems in our enforcement personnel. We need to think how to create and to serve people who have mental health needs. And I think the best way to think about it right now is to transition to digital solutions that can rapidly and affordably increase mental health service needs. And there is great effort already in place. There is more and more science supporting that, but using really digital mental health is really a must now. I don't think we have another good solution really to address the need itself and our barriers to mental health care at this point.
Thank you. Thank you very much, Dr. Neria. I want to turn it over to Dr. Stanley. Dr. Barbara Stanley is Professor of Medical Psychology in the Department of Psychiatry at Columbia University, and she's also the Director of the Suicide Prevention Training, Implementation and Evaluation Program in the Center for Practice Innovations at New York State Psychiatric Institute. So with that, we're going to turn it over to Dr. Stanley.
Thank you. Next slide, Jeff. So first, I want to just thank you very much for inviting me to this panel today. I think this is an amazing meeting that you have pulled together in such a short period of time. And I particularly appreciate being invited to speak before the police. Earlier in my career, I was on the faculty at John Jay College. And so I have a great affinity for working with police officers. So I'm going to be talking about emotional and physical reserves and post-traumatic growth today. But I first want to kind of put this in the context of suicide risk, because I spent most of my career doing research on suicide and working with people who are suicidal. And you'll see why in a minute why this kind of fits in with resilience, building reserves, and post-traumatic growth. So I probably don't need to say this to this group, but addressing suicide risk in law enforcement is absolutely critical. And in preparing this talk, I went through like, well, why, what are the particular risk factors for this group of people? And so that's why I came up with the idea. This is like the perfect storm because there are so many risk factors. We already know that the suicide rate in protective service occupations is elevated. And by protective services, of course, includes police. And we also know that men die much more often by suicide than women. And if you look over to the right there, the distribution of male to female police officers is predominantly a male population. The rate of suicide these days is highest in middle-aged men. And again, that is in large part the police, the age group of many of our police officers. When you look at how many people died by suicide in the United States, nearly 70% of the suicide deaths in 2018 were accounted for by white males. Adding to that, the major way that people die by suicide is the use of firearms. So a little over 50% of suicide deaths are with firearms. And so, and then finally, we also know that severe stress increases risk. So you put this together, and so you have police, of course, experience severe stresses, especially now. I mean, it is an ongoing issue within policing, but it's even much more elevated with COVID and the racial strife that's happening now. So you have severe stresses, you have access to firearms, and you have a population of that is by their demographic factors more at risk, in other words, in men, and they are in an occupation that places them at risk. So, so it is particularly important to address that the fact that we need to kind of keep this in mind and then do something about it before we get to the point where people actually do something to hurt themselves or need care. So next slide. Okay, so I know that you have probably talked about this yesterday and maybe earlier today, but I just want to kind of define resilience for us. Resilience is not something that we're born with, and this is really important. I used to think that, okay, either you're resilient or not, and it's just kind of a property of a person, but it's not. It's something that we can build in ourselves. And so what is it? It's adapting well in the face of adversity, trauma, certain kinds of loss, threats, and significant sources of stress. So you can see that for police, we should be, we should be really paying attention to building resilience because of the need to adapt, because they are facing adversity, they're facing often loss, and of course, they have significant sources of stress. And so what does resilience include? It includes bouncing back from these difficult experiences. It doesn't mean avoiding them, it means bouncing back. And then the thing that I want to talk about later is that it also produces the opportunity for significant growth. So in the face of adversity. So it's what you do with adversity, and I'll talk about that at the end. So, but basic to resilience is maintaining and building our emotional and physical reserves. And so if you get somebody in therapy or in some sort of treatment, and say we teach them new coping skills or how to deal with things, but it does nothing if they have little or no reserves. So if the reserves are depleted, it doesn't really help us to try to do anything for the person. So let's go on to the next slide. Okay, so this is a little bit complicated slide here. So what I'm trying to show here is if you think about that, the bottom line as depleted reserves, that long flat line, and that the curve is a crisis that comes along or a stressor. And so you can see that if you have reserves that are at a higher level, like that second line, you have more ability to cope when a crisis or trauma or stressor comes along. And so what we want to try to do is keep that line up to that second level, the higher level. And so that when the crisis comes along, when the trauma comes along, when the stressors come along, which for police officers, it can be a nearly daily occurrence, we have the reserve to deal with it. So next slide. Okay, so how can you tell that you have depleted emotional or physical reserves? This is kind of a checklist that people can look through themselves. And so this is not rocket science here. You probably can tell in your colleagues if this is happening for them. So there is a lack of pleasure, and so you might think that this has to do with depression, but this is not really just about depression. This is just about I'm running on empty. So a person doesn't experience pleasure, interest, or even any kind of zest or zeal for life. Sleep quality is poor. Doesn't mean that they don't sleep, but it's like waking up repeatedly over the course of the night, having insomnia, inability to concentrate on normal activities, kind of like talking with the person and they're kind of lost in their own thoughts, or they're seemingly distracted. They're just not paying attention. Chronically fatigued. Of course, this relates to having insomnia, but it also relates to just not feeling well. Having what we could consider a bad attitude, and I put that in quotes, because it is also a sign of being depleted. Negativistic, feeling pessimistic, and kind of coupled with that is like things just feel too difficult. It takes too much energy to do that extra little thing. And then something that may seem like not related, but But I think we can all, if you think about this, we can all relate to this. If you've had a bad night's sleep and you go to a meeting or you go on duty and you find yourself like kind of quick to anger, like sharp response in a way that you wouldn't normally respond, irritability, that kind of thing. It's, we're just empty. And then finally, hopelessness. So you don't need all of these signs to say that you are emotionally and physically depleted, but these are just some of the indicators. So next slide. Okay, so now I just want to talk for a couple minutes about, okay, so what do we do? I don't want this to be just about, oh, it's bad, bad, bad. We can do something about this. And so and again, this is not rocket science. There are very, very simple things that can be done. And I work with my patients on this all the time. And we're not talking about fancy kinds of interpretations about your behavior. This is just your very basics of life. So maintaining your physical health, that is the bottom. And just like we take our cars in to be serviced, we need to service ourselves. And so I guess when I was writing this talk, I was thinking, oh, this is the Me Too movement. Me too. I too am important. I too have to take care of myself. So it's a very different meaning of Me Too, but I think that we have to really take this into account, that Me Too, we need to consider ourselves in addition to considering everybody else and all our other responsibilities. It's just like on a plane, when the air pressure, the cabin pressure goes down, we all know that if you're traveling with a child, you put the mask on yourself before you put it on the child. If you can't take care of yourself, you can't take care of anybody else. And then again, we are social beings. So it's really important to attend to personal relationships and do those maintenance activities with our important relationships. So don't just take them for granted. And it's not just about making sure that the other person in the relationship feels good about you. It's so that you feel good about the relationship, and to try to avoid social isolation. As a police officer, you're not going to be socially isolating very much. And then finally, engage in meaningful. And meaningful is very different things for very different people. And again, I put that in quotes because it depends on you, like what is meaningful to you. What's meaningful to me may be totally unmeaningful to another person. And so we want to engage in meaningful, healthy activities, and I stress healthy, that have the potential to provide some sense of satisfaction and pleasure. So it's whatever floats your boat. It's volunteering, religious group attendance, any kind of hobbies. And so you can see that we're talking about here the physical, the social, and then the emotional or personal with activities. And so that's the kind of like the simple recipe. And so as it was just mentioned in Dr. Neria's talk about, like most people are resilient, this helps build resilience and maintain resilience. And so that you don't get to the other pathway that he mentioned, which is where you develop frank symptoms, and you might develop PTSD. Next slide. Okay, so maintaining emotional and physical reserve is difficult. So, and that is in this era now of COVID-19, for some it seems much more difficult to maintain emotional and physical reserve, but it is absolutely necessary. it seems like, and I don't know about the rest of you, but that work has just expanded. And it just has this way of like taking over life almost entirely. But if that's what happens, then there's no way of maintaining emotional and physical reserve. I think I should play this for myself in the morning as I start my work day. But it's absolutely vital. And it's particularly vital for frontliners who are exposed to ongoing and severe stresses and trauma because, as I said, you have these stresses and traumas that come along, and your ability to deal with them is much better if your reserves are high. Next slide. Okay, so this is kind of where I wanted to end. So I've been thinking a lot about, okay, so what is the good of COVID? And so I am, as you can see there, I'm making a lemonade out of lemons kind of person. Like everybody else, I've experienced traumatic events in my life, and so I've tried to kind of really embrace this idea of making lemonade out of lemons. And so with that comes the notion of post-traumatic growth. Now, this is not saying, oh, hey, isn't it great that we have COVID? Isn't it great that that we have all of these terrible things going on in our lives at this particular point? Absolutely not. It's just acknowledging that in the face of stress and trauma, we kind of have a choice. And I really do underline the idea of choice. Now, it may not, for some people, it's kind of not a choice, but we can try to make a choice. And so this is, I think, a very beautiful diagram here. So you have a stress and trauma or trauma, and we all try to cope. And so then you have like this choice point. And so this is particularly difficult with COVID because it's not an external event. It is just going on and on and on, as opposed to 9/11. If you were in the city and you lived through that was like, it was a single event, and then we all had to figure out how to cope. The coping is an ongoing thing. However, you have a kind of a choice point here. And I thought this was very beautiful because when I experienced a particular trauma, I didn't know that this slide existed, this paradigm. I remember thinking at one point, well, I have a choice here. I'm kind of at a really low point. I have a choice. I could go back to where I was, like build myself back up, or I could change. So homeostatic is the change piece. Transformational, homeostatic is the go back to where you were. Transformational is the opportunity for change. And that's the thing that I was talking about in the beginning, that even though this is terrible, we can kind of figure out a way to use this for good in us. And so you can go back to restoring balance, or you can think about ways that are positive coping. And so finally, so transformational is, I would say, it's the riskier way to go, because what happens here is if you transform can be either good or bad. And so the negative transformation is using substances, depression, becoming suicidal, and so forth. So that, of course, is extraordinarily high risk. On the other side is positive coping, which takes a lot of effort and energy, out of which we can become, and this is not pie in the sky, and I'm sorry if it sounds like that, to become something more, something better than what we were before. And so, I'll just end by saying, I have, a lot of you probably have young children going through this at home now, having to do online school. and everybody worried about the mental health of our children. And I have been thinking a lot about what's the good, like what are these kids who are growing up now going to be able to take with them about their ability to survive and to be resilient for the rest of their lives. So I'll end there. Thank you.
All right, I'd like to introduce Dr. John Violante. He served the New York State Police for 23 years as a trooper and a criminal investigator. He's currently research professor at the Department of Epidemiology and Environmental Health at Buffalo. So I'd like to turn it over to Dr. Violante.
Thank you, Monica. Let me get this larger here. Just to start out, I'd like to thank Dr. Stanley for her speech. I think she made a lot of great points there. In terms of growing from your experiences with trauma and stress, there's this fellow back in 65 BC named Horace made a very interesting comment. And his comment was that adversity has the effect of eliciting talents which in normal circumstances would always have lain dormant. Meaning that if we have never experienced trauma and stress in our lives, we probably would have never recognized the fact how well we can handle these things. And I thought that was a very interesting comment from a fellow way back then. I want to talk a little bit today about the organization, the police organization, and its role in establishing and maintaining resiliency among the troops out there in the field. Resiliency, as defined by our former speakers, has to do with coming back from things. It's the capacity of individuals to maintain balance and even get better in the presence of significant disturbances in their lives and their job and in what they do. In order to facilitate that growth, that maintenance, individuals need support. Now, if you're a police officer, one of the best places of support that can be found, besides your family, is the organization. And unfortunately, there always seems to be a sort of a split between the organization and the individual officer in terms of how they feel about each other. And I think that's rather unfortunate because the organization can be a great support mechanism for the officer on the street. There are three primary ways that resiliency can help you or help you keep you in a resilient way. Number one is recovery, and that's the ability, as we talked about, to bounce back from the negative effects of trauma and stress. The second is sustainability. And once you bounce back, you need to stay there or you need to get better. And unfortunately, as human beings, as individual human beings, we can't do that by ourselves. We need the support, the social support of individuals, organizations that we work for to help us get through things like that, especially traumatic events and PTSD-like events that our officers are all experiencing now these days on the streets. The third is growth, and Dr. Stanley talked about post-traumatic growth, and what that essentially is what she said. We can get better by experiencing adverse events. We can get better without adverse events, but they certainly let us know how good we are in dealing with trauma. So I find that very interesting, and I think that as a police officer, the amount of events that you experience in your career and every day sometimes really make you realize to some degree how good you are. You know, police officers are probably the most resilient people I've ever met in my life, and I think they need that support to keep them at that point. I think it's very important. What can leaderships do? What can leadership do in organizations to help officers to maintain that resilient stance in their lives? Foster commitment, and I'll talk more about these in detail, allowing a sense of control over their job. You know, it's not just, hey, you're going to do this, you're going to do this, you're going to do this, and I'm not going to tell you why, but you're going to do it. Okay, that sort of ethos is what alienates the organization from the individual. And I think there needs to be a sense of control of the officer on the street in terms of decisions, in terms of what goes on in his or her daily life. And third, make the job more challenging for the individual officer. Change is difficult, and nobody likes change because it causes problems for a lot of people. But by the same token, you can grow from that change, you can get better, and you can eliminate a lot of problems. Well, how do you build commitment? As a leader, you can build commitment by supporting the troops. Number one, supporting the troops. Throwing the officer under the bus is probably one of the things that alienate the organization from the individual. And I understand the politics of this, I understand the reasoning of organizations, and I understand what goes on in the police organization. But there needs to be an ethos of, I'm going to help you get through this, officer. I'm going to help you get through this. Even though there's not much I can do. The least I can do is emotionally support you. So I think that's a very essential point. Secondly, and again, not all leaders like to do this, but spending time with the troops. Usually leaders like to have this sort of division that, I'm a sergeant, I'm a lieutenant, I'm a captain, and you're an officer on the street. Well, that causes a lack of communication. And bureaucracies are just made this way. I mean, from the top on down, the lack of communication is evident. That those in the middle can't communicate with those on top, and those on top can't communicate with those on bottom. And this leaves big gaps in understanding as to what policy means and what goes on. So I think it's important that we do that. Secondly, share hardships with the troops. When your officers get in trouble, when they're traumatized, when they've had no sleep, in which working 12-hour, 16-hour shifts, doubling back, what can you do? You can share those hardships. It's not difficult. It's not difficult to stop into the field and see how things are going if you're a leader. It's not difficult to go to a hospital if an officer is injured or shot and is in the hospital. It's not difficult to visit that officer in the hospital if you're a leader, especially near the top of the echelons. These are important things. These mean a lot to the officer on the street. When I was in the service, one of the things we had to do in basic was crawl through the mud under barbed wire while they were firing machine guns over our head. And we had the second lieutenant who came up in his beautiful white, clean uniform and did the same thing we did. Well, this immensely made us respect this individual much more. So, there's an idea, that just a simple example of what leadership can do to help people maintain that basic resilience. When you make a change, you need to provide information as to why you're doing it, not just what you're doing, but why you're doing it. I think for officers can understand better why you've made these changes. How do you build control? You build control by providing tasks to the individual officers that are challenging, but that they can do. I mean, you can't give an officer a difficult task that they can't possibly accomplish and expect them to do. And unfortunately, in police work, a lot of times we're put in that position where we don't have the resources, we don't have the things to let us completely deal with the situation. So it puts us at risk for losing our ability to deal with stress. Build on success, short-term steps and so forth and so on. And as far as challenge goes, we're going to fail. There's no doubt about it. We're going to fail. Everybody fails. And we need to treat failures as a chance to learn something, to benefit from that failure and to make us better police officers. As far as mental health sustainment, education is important, I think, especially at the recruit level. Inoculating recruits to the trauma they're about to experience in their next 20, 25 years. Getting trusted, well-informed mental health professionals that understand police work. Very important, We had an officer that went to a mental health professional, and he was a marriage counselor, and that's great, you know, but it didn't help him get through his trauma. So there needs to be a match in there. A good peer support unit, which I think a lot of departments are going. I know NYPD works well with this. Communication is important. Training supervisors, very important. A supervisor needs to understand what mental health is about, what the symptoms are, what the possible suicide warning signs are, and so forth. We know that suicide is elevated in our profession. I mean, we've seen this in our studies, in our national studies as well. And lastly, something that's being done in a lot of departments is the psychological check-in, where an officer might come in once a year, talk to a peer support or a psychologist that they trust, and talk about what's happened over the past year. Nothing doesn't have to happen, but it's just a way for a chance for the officer to vent, to talk about things that they might want to talk about. So just to end, I think I read this article by a Canadian police chief named John Jones, and yes, that's really his name. And Chief Jones said that as leaders, we have a duty of care. And that duty is to take care of our people. If we don't care about our people aren't going to care about anybody else. And certainly we can't have that on the street today. So I leave you with that, and thank you very much for what you do. You are appreciated. Regardless of what you see and hear sometimes, you are appreciated by our society. Thank you. Go ahead.
Great. Thank you, Dr. Violante. Can you hear me? Just lost that now.
Yep, we can hear you. You're good.
Great. I want to thank all of the panelists. Thank you so very much for participating and sharing your ideas. You know, as the Assistant Commissioner of Equity and Inclusion at NYPD, and also being a licensed psychologist, I often think about how we describe and think about law enforcement, and we often characterize it as a family. And so in terms of talking about resilience, there's a piece of it that's about also workplace relationships. You know, and Dr. Neria talked about that we are social species. And so we rely and get cues from one another. And in that way, everyone to your left and right are sort of active partners in making sure that you are in an environment where you have a sense of belonging, where you're not doing the work of, should I even be doing this work, or am I valued doing the work, but that you're able to free up yourself and really have more, I think Dr. Stanley talked about reserves to do what is actually needed, the hard work of being in law enforcement. And so, you know, I think that's a really good point. And Dr. Stanley talked about choices when you're coping. And I thought it was just really amazing to think about homeostatic, you know, sort of coping. Like I can come over here and I can bring things back to the way they were, or I can use those experiences and make them transformational. And I thought that was a great point. And then Dr. Violante, thank you for implicating the organization itself and the leaders, because they are certainly partners in building resilience. And you know, especially when it comes to alleviating stress. There is all sorts of stressors, but sometimes it's the minutia of the day and the minutia of the work that we can sort of take away from, you know, our people in the field, because there's so many other things that they're trying to work on and you know, and stressors. I think the bottom line is, let's not create more stressors in the workplace. You know, let's let them build reserves and focus on enforcing the law, if you will. So with that, I want to again thank all of our panelists. Thank you for your thoughts and your ideas. I think the models, I hope that they were meaningful, because it really gave a great picture of where we can sort of, you know, take our thoughts about resilience as well as mental health.